Well, as usual, we will be bringing in our program Focus on Health with me, Kuenzang. This segment of our health program will talk on hepatitis. Therefore, I'm joined by the head clinical counselor, Kuenzang Choden, from HISC under Jigmedoji Wangchuk National Referral Hospital. So thank you for joining us on hepatitis program. Let me begin by asking, sir, what actually is meant by hepatitis?
Thank you. I think this is a venue where we can bring a lot of information to our people across the country. So the meaning of hepatitis B. In fact, the hepatitis, hepa means it's a liver and titis is a disease, in fact. So it's a liver disease, hepatitis. Now, hepatitis actually refers to the virus which can affect the liver cells in the course of time.
The term hepatitis, does it have different forms of hepatitis in itself?
Yes. There are various kinds of hepatitis, in fact. There are hepatitis A, B, C, D, E, and so many, in fact. So among this, which is making a problem in general is the hepatitis B and hepatitis C. So other hepatitis are usually is a temporary, so due to unhygienic, it is called known A, known B. So this can affect us, but after some time this will go away. But yes, this hepatitis B and hepatitis C will remain in the blood for a very long time.
Yes, so among the list of those various types of hepatitis, B and C is considered to be one of the major thing in our country that's affecting us right now, cause of concern.
Yes.
So what could be the reason?
Actually, in the beginning, it was quite a mystery, and the hepatitis was not actually considered as a public health problem worldwide. So only in the recent years, now the hepatitis B and hepatitis C is one of the problem, to cause the liver cirrhosis in general. A lot of research has been conducted by the scientists, and then it showed that hepatitis B and hepatitis C is one of the infectious, yes, and it really causes problem among the general population.
Yes, so it's more risky to the general public. Okay, so how does one usually land up getting this disease, the hepatitis?
The mode of transmissions, hepatitis B is usually through sexual contact, yes, the blood transfusions, and sharing of the object like syringe and needle, and also people who are trying to beautify their body by tattooing. So these are some of the mode of transmissions, and also from mother to child as well. So now when it comes to hepatitis B, it's quite challenging for people to understand. So we have now translated into our own language, yes, so that people can understand. Usually we try to say that chimgineji. So not all hepatitis B people who are harboring this virus can lead to cirrhosis or liver cancer. There are certain amount of infection which will be in the blood for a very long period, but few people will definitely turn into liver cirrhosis and cancer as well.
Yes. By chance, are there any similarities between HIV/AIDS patient and the hepatitis patient?
Yes. If you look at the mode of transmissions, it's not really different because the transmissions are very similar. But if you look at the transmission rate compared to HIV and hepatitis B is much higher compared to HIV.
Yes.
So that's the reason that now we have to make our people aware, and our people should know how to prevent this, getting hepatitis B or hepatitis C infections as well.
Yes. Among these two types of diseases, which is considered to be more major or say risky?
If we look at the incidence or the prevalence in the country, the hepatitis B is much more. Hepatitis C is very minimum.
Yes.
And when you look at the impact from these two different hepatitis B and hepatitis C, I think the hepatitis C is going to be a little bit more, serious compared to hepatitis B.
Lesla, if ever the records have been mentioned, what is the current status of such hepatitis cases in our country?
Maybe mid 2005, we have conducted studies among the general populations. And this population, the focus populations, are normally people who visit hospitals. So in order to find out the incidence and, the prevalence of hepatitis B among the general population, during that study, we found around 10% of hepatitis B among our general populations. And that was not really a conclusive, so we sent those samples to some other reference lab in the West, and then it came back as we have almost 5% prevalence. So that was the very reason that if we look at the World Health Organization guidelines, if any infection prevalence is beyond 3%, means if there is possibility of giving vaccinations. So we have started these vaccinations to the young people since 1996 onwards.
Do we have any current record, love?
Yes, but at this point of time, I'll not be able to tell you the correct figure, but there are. It is already maintained with the Health Information System with the Ministry of Health. So if at all require, I think we can use those informations from Ministry of Health.
Yes, but as somebody working under health, I'm sure sir would be in position to tell at least whether it's increasing or whether it's...
Oh yes, if we look at the trend when we do some testings, provide testings to the people who come to the hospital and to our centers, it is not really increasing, but it's very similar. Trend is not really increasing, but trend remains almost the same. So now, if we look at the vaccination program, which is instituted since 1996, during that time we have 5% prevalent, and now it's been quite some time that we have provided vaccination against hepatitis B among young general populations. So in order to find out, and there has been some studies.
Yes. By the way, what kind of symptoms can we expect in case if we are to be suffering from hepatitis?
If the person has a hepatitis B, and hepatitis B may impair the liver functions. When the livers are not really functioning well, then the people develop jaundice.
Yes.
And obviously, they will not be able to eat well. You can see it is called icterus, that is a coloration in the eye, skins, and so on. So basically, the hepatitis means the virus might, harm our liver cell, and then the livers are not able to function, and then there may be some obstructions as well.
Yes.
So due to the complications of hepatitis.
Yes. Likewise, would it also bring physical changes to that person if he's suffering?
Yeah.
In terms of appetite loss and all.
Loss of appetite is there, and then people will definitely feel lethargic. They will have no activeness, and they lose a lot of interest in any kind of activities.
Usually, who are known to be more prone or closer to getting such kind of disease, the hepatitis? Can age factor also determine the disease?
No, this infection can transmit to anybody. But if you look at the age factor now, among the adolescent and then the adult, because the activities, human activities is much more. So this group would get more compared to young populations, because when you look at the mode of transmissions, the mode of transmissions are through sexual contact, sharing needle and syringes, then mother to child, and also one mode of transmission is through infected blood transfusions. But infected blood transfusions normally we screen. All infection has to be screened before the transfusions are provided.
Yes. But in our country, how has the trend been?
So the hepatitis B, in fact, is quite a mystery. Now the person could have multiple behaviors. They may have multiple sexual partners, and usually when we diagnose or when we detect hepatitis B, it is among the people who have multiple sexual partners, and also, the mother-to-child transmissions. So this hepatitis B, in fact, if the person gets this hepatitis B infections from the parents, this is more likely to be a chronic infection, which may not cause so much serious to the individuals. But the person who gets through sexual contact and sharing needle and syringes may have more serious problem in the liver.
Yes. So these two are the major factors contributing to hepatitis: multiple sexual intercourse and from mother to child infection.
Mother to child, yes.
Yes. Do you think our people are well aware of hepatitis?
I don't think so.
Yes.
I don't think so, because now when we counsel our people, people never heard about hepatitis. So in order to counsel and what actually hepatitis B does to the person, we have to take a little more time and then counsel them, give educations, and then in future how to prevent getting hepatitis B, and if one has a hepatitis B, how can they stop further transmissions as well.
So what do you think could be the reason for these people not being still aware of this very disease? Is it from the health ministry side, or it's from themselves itself that the gap is coming in between?
I think the gap is not due to the individuals. I think there has been some program from the agencies, the Minister of Health. But now when we look at the Minister of Health, when I'm mentioning, because it was not really a concern, not only the Minister of Health, but also, in other countries as well. So that was the reason why people didn't have much information about hepatitis B and hepatitis C.
Yes. From here on, how does the ministry intend to tackle this gap between people and the disease?
Yes.
Any plans and programs that people are trying to implement?
Yes. Now, the hepatitis B, the program has been taken over by the National HIV Control Program, the Department of Public Health, in a very recent years. And under this, we have a program to give advocacy and awareness to the general populations.
Yes.
And also we have now testing facilities which has been extended even up to the BHU level. People can go and do the testing, and even our health workers are all trained how to counsel, how to give information to the general public. So the main reason for why we have given this testings up to the BHU level is we are focusing more on the pregnant women. So pregnant women, because if the pregnant woman is infected with hepatitis B, we are planning to protect at least the baby by providing some immunoglobulin injection. Of course, this is very expensive, but still the government provide free, of course.
Yes. Do you mean to say that these testing facilities are already in place
Yes.
over the Zongkok?
Yes. In 20 district hospital, not only 20 district hospital, but now we have across the BHU level.
Yes. Now the facilities are in place.
Yes.
But how are the turn-ups in terms of people coming for hepatitis treatment? Because even if we install all the facilities, if people don't turn up, then I think it's quite useless.
Oh yes, it can be. It can be because people have no information at all. Now we have started providing information to general public through various programs. Not only the health people are trying to make people aware, but we also involve a multi-sectoral approach. Because we have multi-sector task force in each district and each GIOC. So these people, whenever they have some program, so at least one kind of information, the members will provide the information when there is a mass gatherings. Because in the beginning, people they didn't know much about hepatitis B. Now, since we have services available at the BHU level, and then we already have started giving informations about hepatitis B, how to take care of hepatitis B, how can we prevent, if there are any, how to get the treatment. Those informations are already passed down to the village level, and now the people have actually started coming forward for hepatitis B testings.
Yes. What are some of those treatment procedures for?
I just want to mention one thing, that any infections, caused by virus is not really curable. Of course, it doesn't mean that we don't have a treatment. There are treatment, but treatment has to be, symptomatic. So this hepatitis B treatment, of course, there are some injection against virus. But this injection will not cure 100%, but the number of virus should reduce by providing these injections.
Yes.
So this is basically to reduce the number of hepatitis B virus. But more than that, I think the treatment has to be on the symptomatic based.
Yes. Among many types of hepatitis diseases that Sir has mentioned already, I think hepatitis B is known to be more time consuming when it comes to detection.
Oh, yes.
What about other types? How are they being detected, and the duration of their treatment? How is it?
So I probably, the question is very much appropriate to the physicians, in fact, since I'm not a physician.
Yes.
But anyway, I will give you a little information about this.
Little insight from Sir's side would be of great help to our listeners.
Yeah, so the treatment, in fact, as I have mentioned earlier, that it has to be symptomatic, and other non-A, non-B. So this will go away in 1 or 2 weeks' time. And this basically, comes from unhygienic, food contaminations and so on.
Yes.
But this hepatitis B and C is usually very specific to how to get the infections. Soon after getting infection, the test will not detect positive, because it has also some window period. It carries from 3 months to it goes up to 9 months. So people, even after infecting hepatitis B, they may not show positive in the blood testing.
Yes.
So the testing, it will be possible if we have some sophisticated or more expensive chemicals and equipments. But in our country, what we do is we only do antigen testings. That is called hepatitis B surface antigen testing.
Yes.
In order to really confirm the person is really infected in the recent years, then we have to do antibody testing. And this antibody testing is very expensive, so we cannot afford in the country.
Yes. So what do you all do? Do you all send the patient outside, or?
No, actually, once the person is found to be hepatitis B positive, so we consider positive.
Yes.
So there are certain things that the person needs to change their own behavior. So hepatitis B virus or hepatitis C virus is going to affect the liver cell. On top of this hepatitis B infections in the person try to drink alcohol, so they get 2 bullets. So the symptoms are much faster compared to the non-drinker.
Yes, but is there possibilities whereby this chronic hepatitis B patient can live again?
Oh yes. The chronic infection means they are a kind of a carrier. So they will carry this hepatitis B in the blood for so many years.
Yes.
It may go up to even 60, 70 years without much problems.
Yes.
But few people will develop, the liver problem within 1 year also.
Now, so far in our country, did we see any death among our people due to hepatitis?
Yes, there are. But, due to single hepatitis B would be a very minimum death due to hepatitis B infections. But people with hepatitis B with alcohol intake, the death rate is so high. So almost, if you look at the status with the JWNRH, in 1 year, about 30% of the patients who are visiting the hospital, they die due to hepatitis, the liver disease. And these are mostly contributed through alcohol. So alcohol liver disease.
So it's more or less related to alcohol use.
Also, yes.
So I think
the alcohol will not lead to hepatitis B or the hepatitis C. But the only thing is now the hepatitis B will, spoil or, try to disorient the liver cells. And even, on top of that, people drink alcohol. So alcohol will also, affect. So this is a big contributions for the people who are with hepatitis B infections.
And lastly, your thoughts, especially on this hepatitis disease, which is now becoming a cause of concern in our country. What would you like to tell our listeners?
Thank you. So I would definitely inform our general population that they should try to get access to health services, and they should try to get more information from the health workers and from the medical doctors, so that they are prepared not to get these infections in future. Even if there are someone in the family, we have to take care of them, and we have to educate them not to transfuse the blood, not to share the needle and syringes, and whenever there are some accidental happens in the family or to the person who is infected with hepatitis B, they should not share, or other people should avoid touching the blood product. People should always try to screen out, get tested for hepatitis B. That's very important. If the person is free from hepatitis B, then I think they should take precaution. If the persons are infected with hepatitis B, then they should try to look at what are some of the things that is best for them, what are some of the things which is bad for them.
Thank you so much for creating awareness on hepatitis.
Thank you.
Well, that is all from the Focus on Health for now. You can join me every Mondays and Thursdays at 5:20 p.m. for our fresh editions. Thanks very much for tuning in.